You go about your day. Maybe you stood up from the couch. Maybe you laughed a little too hard. Maybe you just rolled over in bed. And suddenly, out of nowhere, a sharp stabbing pain shoots through your lower belly or your groin and you freeze. What you likely just felt has a name. It's called round ligament pain. And today we're going to break down exactly what it is, precisely why it happens, and most importantly, what you can actually do about it so that you stop being caught off guard every single time. But first, the next time you attend your antenatal appointment, tell your healthcare provider you've been experiencing this. Describe it, even if it feels minor. Your provider needs to know so they can confirm that's exactly what it is and rule out anything else. That conversation takes 2 minutes and gives you enormous peace of mind. So don't skip it. Now let's get into it. So what exactly are round ligaments, and why are they causing you so much drama? Picture this. Deep inside your pelvis, you have 2 rope-like bands of tissue, one on each side of your uterus. These are your round ligaments. Before pregnancy, each one is roughly 10 to 12 centimeters long. Their entire job is to hold your uterus in position, to keep it anchored to your lower abdominal wall and groin area so it stays where it's supposed to be. Now here's where pregnancy changes everything. Before you got pregnant, your uterus weighed roughly 70 grams. By the time you reach full term, that same uterus will weigh over 1,000 grams. That is more than 14 times its original weight. And those 2 small ligaments, they are responsible for supporting every bit of that growth. So they stretch, they thicken, they are under constant, escalating tension for months. And when something causes them to contract suddenly, a quick movement, a sneeze, a laugh, they spasm. That spasm is the pain you feel. Sharp, sudden, shooting, gone in seconds, sometimes lingering for a few minutes. That is round ligament pain. It is your body physically expanding to hold a new life, and it affects somewhere between 10 and 30% of all pregnancies. So if this is you, you are very much not alone. Now let's talk about why it happens, because understanding the cause is what actually helps you manage it. There are 6 key reasons. Cause number 1, your uterus is growing faster than your ligaments expected. Uterine growth during pregnancy doesn't happen in one smooth, gradual stretch. It happens in spurts, periods of rapid growth that correspond with your baby's development milestones. And each time your uterus grows quickly, those round ligaments are pulled tighter almost overnight. That sudden increase in tension is one of the primary reasons a pain can feel so random and unpredictable, because it genuinely is tied to your baby's growth pattern, which follows its own timeline entirely independent of yours. Cause number 2, sudden movements are the biggest trigger. This is the one most women figure out quickly. Standing up too fast from a chair, rolling over in bed, reaching for something above your head, sneezing, coughing, laughing, yes, even laughing. All of these create a sudden spike in abdominal pressure or a rapid shift in your body's position. And your round ligaments, which are already stretched tight and under constant tension, react to that sudden demand by contracting sharply. The result is that shooting, stabbing sensation that feels completely disproportionate to how small the movement was. Cause number 3, your hormones have loosened everything up, including your ligaments. During pregnancy, your body produces a hormone called relaxin. Relaxin's job is to prepare your body for childbirth by loosening your joints and ligaments, so your pelvis can expand enough to deliver your baby. Brilliant design, but it comes with a side effect. Those same loosened ligaments, they're becoming more flexible and pliable, are also becoming more vulnerable to strain. So while relaxin is doing exactly what it's supposed to do, it simultaneously makes your round ligaments more susceptible to spasm when placed under sudden demand. Progesterone adds to this by relaxing smooth muscle throughout the body, further reducing the structural support that would normally cushion movement. Cause number 4, your blood volume has nearly doubled, and that creates pressure during pregnancy. The amount of blood circulating in your body increases by up to 50%. This is essential. Your baby needs a rich, constant blood supply to grow. But this dramatic increase in blood volume causes your blood vessels to expand, and that expansion adds additional pressure in the pelvic region, directly where your round ligaments sit and work. That sustained pressure contributes to the tenderness and sensitivity you feel, even on days when you haven't made any sudden movements. Cause number 5, everyday physical strain. This one often surprises women because it's so ordinary. Simply walking for extended periods, sitting in one position too long, carrying groceries, standing for hours at work. None of these feel like significant physical exertion, but each one places continuous, low-level strain on ligaments that are already working harder than they ever have before. Over time, that accumulates, and what starts as background tension can tip into real discomfort by the end of a busy day. Cause number 6, carrying multiples or gaining weight rapidly. If you're carrying twins, triplets, or more, your uterus grows significantly faster and larger than in a single pregnancy. The load on your round ligaments is proportionally greater from much earlier in the pregnancy. Similarly, rapid weight gain during any pregnancy accelerates the tension placed on these ligaments before they've had adequate time to adapt. Previous pregnancies also play a role. Ligaments that have been stretched before reach their limit of elasticity more quickly the second or third time around. So now the most important question: what can you actually do? The single most effective thing: slow down your movements. This sounds almost too simple, but it is genuinely the most powerful tool you have. The pain is largely triggered by sudden contraction of an already stretched ligament. So the antidote is removing the sudden. When you're getting up from a chair, do it slowly and in stages. Shift your weight forward first, pause, then rise. When getting out of bed, roll on to your side first, then push yourself up with your arms rather than sitting straight up. When you feel a cough or sneeze coming, lean forward slightly and cup your hands under your belly to support it before it hits. That one habit alone can reduce your episodes of round ligament pain dramatically. Use warm compresses or a warm bath. When the pain is already set in, warmth is your most accessible relief. A warm, not hot, compress placed over your lower abdomen helps relax the spasming ligament and the surrounding muscles. A warm bath does the same thing on a larger scale. The heat increases blood flow to the area, reduces muscle tension, and gives your ligaments a chance to release. Just make sure the water is comfortably warm and not hot. Overheating is not safe during pregnancy. If you are ever unsure about temperature, ask your midwife or doctor. Rest in a supported position. When round ligament pain strikes, the most immediate thing you can do is take the load off. Lie down on your side. Your left side is ideal for circulation, and place a pillow between your knees. This position removes gravitational pressure from your pelvis, distributes your weight evenly, and allows those strained ligaments to decompress. You don't need to stay there for hours. Even 10 to 15 minutes in this position during a pain episode can make a significant difference. Wear a maternity support belt. This is one of the most underrated tools of pregnancy, and many women don't discover it until they're already deep into the second trimester, wondering why nobody mentioned it sooner. A maternity support belt, sometimes called a belly band, wraps underneath your bump and redistributes the weight of your growing uterus across your hips and lower back, rather than allowing all of it to pull directly downward on your round ligaments. Women who wear one consistently report noticeably less pain during periods of extended standing or walking. Ask your midwife or OB about the right type for your stage of pregnancy. Avoid standing for long periods and heavy lifting. Your ligaments need practical protection throughout your daily routine. If your job requires long periods on your feet, discuss this with your employer and your healthcare provider. Modifications can often be made. When lifting is unavoidable, bend at the knees, keep the load close to your body, and move slowly. And whenever possible, sit down. Giving your ligaments regular breaks throughout the day is not laziness. It is management. Deep breathing when the pain hits. This one is about your nervous system as much as your ligaments. When sudden pain strikes, the body's instinct is to tense up, which actually makes spasm-related pain worse. Slow, deliberate deep breathing in the moment of pain signals your nervous system to relax, reduces muscle tension in the surrounding area, and can shorten how long each episode lasts. Breathe in slowly for 4 counts, hold for 2, breathe out for 6. Simple, free, and available to you anywhere. Now, before you go, I need you to really hear this. Round ligament pain is normal. It is not dangerous to you, and it is not dangerous to your baby. It goes away after birth as your uterus returns to its pre-pregnancy size. It is simply the physical price of making room for a new life. And now that you understand exactly why it happens, you don't need to be scared of it. But, and this is critical, not every sharp pain in your abdomen during pregnancy is round ligament pain, and you should never assume. If the pain is severe and does not ease with rest, call your provider. If the pain is one-sided and persistent, call your provider. If the pain comes with fever, vaginal bleeding, unusual discharge, dizziness, or contractions, do not wait. Seek care immediately. These symptoms together can indicate conditions that require urgent attention, and getting seen quickly can make all the difference. Round ligament pain passes in seconds. Anything that lingers, intensifies, or comes with other symptoms deserves a medical eye on it. Your body is doing something remarkable. Understanding what it's going through makes you a better advocate for yourself. And that is one of the most important things you can be during pregnancy. Stay informed, speak to your provider, and take care of yourself. If this helped you feel less frightened by that sharp belly pain, share this with a pregnant friend who needs to hear it. Subscribe for more evidence-based pregnancy and women's health content every week. See you in the next one.